Dental implant is a way to replace the missing teeth. It works as an artificial root. First, we need to do a surgery to place the implant in the jawbone. Then we wait for a couple months for the bone to heal. Then we place an implant crown or bridge on top of the implant root. Most people are good candidates for dental implant. However, there are two key factors that we need to consider. First is general health. You should be healthy enough to have the dental implant surgery. Mostly, if you are healthy enough to have the tooth extraction done, you should be healthy enough to have the dental implant surgery. Second is the amount of the bone. We need to evaluate the amount of the bone that you have. Mostly, you may need a CT scan to check out on the quantity and the quality of your bone. In case that you do not have enough bone to start with, we may need to do the bone grafting procedure to rebuilding your bone. First, you will need a consultation with the implant specialist. On the first visit, we will review your general health and also we will ask you about the medication that you are taking. If you have any medical problems, it should be treated and under control. In some cases, we may need to discuss with your physician regarding your health condition. Second, we will take a look in your mouth to do the examination of your gum, your teeth, and also we need an X-ray. This X-ray will tell us how much bone you have. Most of the time, we will need a CT scan, which is a 3D imaging. This will give all necessary information for treatment planning. Once we get all the information, we can finalize the plan and then we can schedule for implant surgery. Implant surgery, in most cases, we do it under local anesthesia. In some cases, if you are anxious or if you are very concerned about the surgery, we also have an option to put you to sleep during the surgery, either by IV sedation or general anesthesia. After implant surgery, we will wait 2 to 6 months for the bone to heal. Then we will do the restoration of top of the implant. Usually for a simple case, it should take about 3 months from start to finish. However, if you do not have enough bone and we need to rebuild the bone, the procedure may take up to a year. Dental implant will work like your natural teeth, so you should take care of dental implant just like you take care of your natural teeth. Brush and floss well daily. And also come back for a regular checkup and cleaning. You should have your teeth cleaned every 6 months, and also your implant doctor might schedule you for a checkup of the implant every year. Usually for a simple case, which means you lost only 1 or 2 teeth and you have good bone to start with, the procedure is very simple. You might feel just a little bit when we give injection, and then throughout the procedure, you should only feel some pushing and pressure. After the procedure, you might have some discomfort for the first couple days and then it will be gone. For a more complex procedure like you lost many teeth, we need to put many implants or we need to do a lot of bone grafting, the pain might be a little bit more. However, it should be controlled pretty well with the pain medication and the pain should not last for more than 3 or 4 days. At Bangkok Hospital, we have many strong points. First, we have good team. We have team of implant surgeon, implant prosthodontists, and also other related field. This will ensure that you receive the treatment from highly qualified dentists. We also have all state-of-the-art equipment necessary for the dental implant treatment, and we only select the good quality product, both for dental implant and for the bone grafting material. In case that you're really worried about the procedure, we also have an option to put you to sleep either through IV sedation or general anesthesia. All the procedure will be performed by the anesthesiologist at the hospital. This will ensure your safety and comfort. With the hospital setting, we work closely with the medical team. This will ensure that you will receive a safe surgery even when you have several medical problems.